Hello everyone.
Hi.
Karibuni to another edition of Patient Support with Patient Support Services Africa.
Yeah.
With Miss
Irene Ogong'o.
And me, Miss Jean Munite Naita Tieno, Amasharo no Nyango.
Ile unataka.
You know. So in previous discussions, we've spoken about patients' rights, patients' responsibilities,
patient safety.
Yeah. And today we are talking about how to speak to your doctor.
Yeah.
What questions to ask. Yani kinagobaga ABC of how to deal with your doctor to get the best outcome. Because that's what we want.
Yes, it
Best patient outcome.
Best patient outcome.
Sindio?
Yes.
But before we go there, Irene, can you just tell us a bit more about the organizations you work with? I always ask you this every week, just because it might be someone else's first time to engage with your platform.
Yeah.
So,
okay. Yeah. So I run two organizations. One is Nurses in Africa, and in there, I empower nurses to be able to provide the best kind of care to patients.
Yes.
So there's mentorship, there's networking, there's quality improvement consultancy. A lot is going on there.
Yes.
And then the other organization is Patient Support Services Africa.
Yes.
Where we guide patients to make the right choices in healthcare services.
Yes.
So that they can save money, save time, avoid frustrations, and get the best outcome out of everything.
Yes.
And we do all this because we realize that for the patient to get the best outcome, the nurse and the healthcare worker has to put in their part, but you as a patient also have to bring your part, because otherwise the equation is not balanced.
Yes.
And that's why we have the two running concurrently.
Okay.
Yeah.
Okay. And it's an amazing organization. They're both amazing organizations, and I have learned so much. Not only what to expect from my healthcare when I go to a healthcare practitioner, whether it's a clinic, whether it's a pharmacy, whether it's a doctor's surgery, you know, I've learned so much, and I'm sure the people who are following this series, and if you haven't seen the previous sessions, they're on our Facebook page, Galactic Productions Kenya, or on our YouTube page, Galactic Productions Kenya. Irene, do you have them on your page?
Yes.
Yes?
Patient Support Services Africa.
Patient Support Services Africa.
Yeah.
So there are many channels of reaching this. Wherever you're watching this on, they will be there.
Yes.
All the videos will be on that platform. Sindio?
Yes.
So kama umeona kwa Facebook, kama umeona kwa YouTube, itakuwa hapo. Aya, sasa. Let us talk doctors, please.
Yes. So the reason why we are talking about this is last week we were talking about what the takeaways were from the Patient Safety Day.
Yes.
And one of them was you need to be upfront.
Yes.
You need to be able to speak for yourself. You need to be able to be proactive. And someone called me and said, you said something about being proactive and speaking for myself.
Yes.
When I go to see the doctor.
Yes.
What exactly am I supposed to ask?
Yes.
How do I engage this doctor for me to get the best out of this visit? That's why we are here today.
Okay.
Yeah. So, basically, it's as simple as ABC, literally.
Yeah.
And the A is when you're going to see your doctor, you have to ask questions.
Yes.
And of course, someone will then ask me, what kind of questions can I ask my doctor?
That's it.
Yeah. So that's what we want to talk about, really.
Yes.
So the first question you should be able to ask is, what are the different treatment options that are available?
Yes.
So I know that most of the time when we go to see the doctor, very few of them give you options.
Yes.
Most of them just, talk to you, whatever, prescribe medication, and then you're off.
Yes.
We are saying you should be able to ask, what are the other options available
to me,
so that you can be able to share in the decision making?
Yes.
Because the options will affect your pocket.
Yes.
Yes. They will affect if your religion doesn't allow it.
Yes.
It will affect many things.
Work. Yeah, I was telling you just before about how I went to my doctor. And I was having a problem with my reproductive organs. And very excessive bleeding. Over the years, I've just had issues. Now, I knew that there would come a point where I might have to have a hysterectomy. Yeah? I went to my doctor knowing that I'd empowered myself with enough information to be able to say, I know these are my options, and I'd like to have a hysterectomy.
Yes.
You see? Now, they said to me, you're still young, you might change your mind about having another child, blah, blah, blah. I said, no. Number one, my child is nearly 12 years old, so I'm not changing my mind there.
Yeah.
There's no way I'm going back to changing nappies. So, only number one. Number two, I also knew financially and mentally as a mother, I did not have the capacity to be able to have another child.
Yeah.
And even if I did in the future, I would be too old, in my opinion, to want to have another child. To want to change nappies, to want to run around after, you know what I mean?
You make it sound like, oh my God.
For me, honestly, for me, being a mother has always been daunting, and not many people actually acknowledge it.
Oh, it is.
And only in acknowledging it did I start learning to cope with finding motherhood extremely difficult.
Yeah.
You know, the guilt, the pressure, all of that stuff. So anyway, I said to my doctor,
these are my options, but I want it to be
I don't
removed.
need it.
Yes.
You know what I mean? And at the point, I knew that financially I would suffer because single mother, self-employed, you know.
Yes.
Being out, because when you have a hysterectomy, it's almost like having a CS. You're out for at least 6 to 8 weeks.
Yeah.
That's what they say.
Yes.
But also what I did was I prepared my body. I exercised, I ate right, I made sure that my nutrition was on point. So my body was in optimal, what's it called?
Optimal.
My recovery would have been as minimum as possible.
Yeah, because you are well prepared.
Exactly. I was well prepared, my body was ready.
Condition.
My optimal condition for recovery.
Yeah.
So by the time it was my surgery date, I would have I knew that it was going to take me 3 to 4 weeks, not 6 to 8.
Yeah.
I had halved my
Because
time by being prepared. But that's because, as you say, I had done my homework, I knew what my options, I knew the repercussions of my options.
Yes. So, and if you don't know your options, then you should be able to ask the doctor.
Yes.
What you need to understand is there's no one size fits all.
Yes.
Everybody, there are very many options for every kind of illness. So you should be able to ask, yes, you have said this, but what's my other option?
Yes.
And think about your finances, insurance, religion, work, everything, your mental status. Think about it.
Yes.
The next question that you should ask the doctor is, what outcome should I expect?
Yes.
You have heard Sharon talking about being told, once you go through a hysterectomy or whatever surgery, you'll be out for 6 or 8 weeks.
Yes.
So you should be able to plan ahead.
Yes.
So if these kind of things, you don't discuss them at that point with your doctor, then surgery is done, you fast forward, you're home, you feel very boxed in because you didn't know you're going to be down for that long.
Yes.
Even including medication.
Yes.
Sometimes you're given medication, you need to ask, what are the side effects?
That's it.
That I'm going to expect from all these things you've written.
Yes.
Because when I get home, I don't want to pay 5,000 consultation to come and see you for side effects.
That's it.
Because that's money.
Yes. And also, if you know that your side effects might include lethargy.
Yes.
If you're going to feel lethargic, if you're going to feel overly tired, then you know, ujipange, mwenye anakusaidianga kazi, ajue, ndakwa nimechoka sana.
Yes.
You have to up your game.
You have to, yes. So that's why the next question you should absolutely ask is, what should I expect from all these things you've written? Whether it's medication, surgery, whatever.
Yes.
Ask. The third question you should ask is, do we have to do it now or later?
Yes.
So long as you're not bleeding or your airway is blocked, so you're not breathing, or your circulation is constricted, you can absolutely be able to defer that treatment until you have money, you're mentally prepared, you've prepared your family, blah, 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 all that.
Yes.
But you need to be able to ask the doctor at that point, is this something we are doing now, or can we do it later? So that you can weigh your options. Because most of the time people feel like everything, do it now, do it now, do it now.
It has to happen now.
Yes.
Yeah.
And some things, especially for surgery, that are planned, you can be able to plan for it to suit your schedule.
Yes.
But if you don't ask that question, then it will suit the doctor's schedule.
That's it.
Not yours.
Exactly.
Because they will look at their calendar and be like, I'm free here.
I'm going on holiday in
Okay,
July.
so let's have your surgery here.
Yes.
But maybe I'm also going on holiday and I don't want to go with, a raw wound.
Yes.
Yeah, so.
Yes.
Yeah.
Or
so,
I don't want to lose my money because I'd already booked it last year. Because many people, it's a big holiday.
Yes.
They book well in advance because it allows them maybe to pay
Yes.
stuff like
yeah,
that.
we do that all the time.
Yeah.
So that is something you need to ask.
Yes.
So remember to ask, is this now or can I do it later?
Yes.
I mean, if you have every parameter in place and you want to do it at that time, but ask just so you know.
Yes.
The next question that you can ask is there anything I can do to improve my condition on my own?
Yes.
Because you're trying to also take responsibility.
Yes.
For example, you said something about to prepare for surgery, you had to, exercise, eat right, so that you're in optimal condition to go for the surgery. So even if it's, say, medical, it's not surgical.
Yes.
There are some things that you can be able to do by yourself.
It's like if you're told you have type 2 diabetes. Type 2 diabetes is something that is reversible. High blood pressure, these are lifestyle conditions that are reversible.
Yes.
So that's something that you then have to ask yourself, how can I, instead of waiting until I need a transplant, this is starting stages liver condition.
Yes.
Which is hard to detect initially because usually it's until it's later stages. So it's beginning stages. I've been lucky because I had a full medical. They've detected beginning stages of liver disease. How can I stop this from getting worse without medication? Say, for example, if you don't want to go on medication.
Yeah, and this is a good time. It will prompt the doctor to give you some education around your condition. So that they're not just rushing through the consultation. Sometimes they assume that, you will Google it, you understand it. One of those things. But every time you ask these questions, it will prompt them to be like, okay, I need to give more education. I need to, and so that it becomes quite interactive.
Yes. And also doctors, they like people who come to them and know part of what the solution might be. I've been feeling this way. Not that you Google all your symptoms, you go to your doctor and diagnose yourself, no. But at least be aware the things that they might throw at you. Don't go there and self-diagnose and say, okay, sasa nipatie dawa na dawa.
No.
They don't like that.
No, they don't like that. Yeah, Dr. Google is based on people's opinions, unless you're going to look for journals and research that has been done. If you just Google it and Irene wrote what she thought about it, that is not a doctor.
No.
So as much as you Google your symptoms and all that, just remember, you're bringing your options on the table and the doctor brings his and then you guys agree.
Yeah.
The next question that you should ask is, how will I get my test results? Because this is a big issue.
Yeah.
Most of the time, there are some tests you will do and get them at the point of care.
Yes.
Some of them, you're told, just go home, we will call you. You don't know how you will get your results. If I came to, say, Nairobi to do one specialized test, and I don't have a relative, and I want to go back, and then they tell me, your result will be out in 3 days. Does that mean me coming back from wherever to come and collect my result?
Yes.
This is the point where they will tell you, okay, we can send it through email, it can be sent through, or let it be sent to my doctor, and then my doctor will reach me.
Exactly.
Make sure you understand all that. So when you're seated with the doctor, as he writes for you whatever the test is, ask if there's any there that will have results coming out after 1 day, 2 days, 3 days, so you can plan, so you can get to understand, will they be sent via email? Do I have to present myself physically? Can they be sent directly to my doctor? So that you can reduce all the delays and anxiety and all that.
And also, it's very important to know, once I get my results, what is expected of me? Will I be asked to come back? Because then, especially if you have to travel from a distance to come get your results, will I be expected to come back? And if I'm expected to come back, would it be possible, as you say, for these results to go straight to my doctor so that when I come back,
yes,
they know already what the course of action is.
Yeah.
Not that you send it to me so that I can then take it to my doctor, who will then have to have time
yes,
to read and understand and process and formulate course of treatment
and all that.
Yeah.
And I mean, imagine if all the tests they send you for are negative.
You don't need to come back.
No.
Yeah.
Because what are you coming back for? To come and take a paper that says everything is negative, to take to the doctor so he can request another round of tests. How about the results are sent to the doctor?
Yes.
Oh, it's negative. Okay, Irene, we need to do another round of tests.
Yes.
ABCD.
Yes.
You go directly there.
Yes.
It saves you time and frustration.
Yes.
Yeah.
And money.
Oh, and money, because transport, whatever, whichever way you look at it, you lose money in the process.
That's
because if you're a business person, you've left your business to come and chase health.
Yes.
Money still.
Exactly.
Yeah.
And we don't like losing money.
No. The other question you should ask that is very important is, how much will this cost?
Yes.
Ask your doctor what those things will cost, the things he's writing for you.
Yes.
Don't live there. Go to the lab. Then they say this and like,
Sikuambiwa.
This is a lot of money. Wacha kwanza nikunje hii karatasi. Let me go. I will think about it another day.
Yes.
If you ask this question when you're with the doctor, you will save money because you will not have to go and look for somebody else to do another consultation.
Yes.
But what will happen is you'll tell the doctor, sina hiyo pesa. Is there any other test we can do that is cheaper that will still bring us back to? You understand?
Yes.
This is where you start weighing options. This is where you're discussing with your doctor.
Yes.
Because half the time we don't ask. We go to wherever we've been sent for the test. Then you get there, I don't have the money, I'm not prepared. Or maybe I don't have insurance.
Yes.
That means, I can't do it.
Yes.
And maybe doing it is the one thing that will save me. Or if I can't do it, the doctor will then say, okay, if you don't have money to do this, do this instead, and let's see what comes out of it.
Yes.
Yeah. So remember, how much will this cost me? Ask your doctor, whether it's treatment.
Yes.
Whether it's diagnostics, ask. And
So,
especially for treatment, before we move on, because for every antibiotic they write and all that, there's a million other options. But if you don't ask, even me, the doctor, will assume, well, yeah, unless they've taken your blood, they've done a culture and sensitivity, and you are sensitive to a particular type of treatment, then they can't have options.
Yes.
But for them to get there, they would have gone through other things.
Yes.
But most of the time, just ask, Daktari, how much would all this cost me? So that I'm like, okay, Daktari, I don't have that money. It's the same thing we do in pharmacy.
Yes.
You go there, they say, my child is coughing, I don't know what else. They give you Augmentin.
Yes.
You say, no. I don't have, how much is it? 1,500.
Yes.
I don't have that money.
Yes.
Do you have another option?
That's it.
How much is that? 700.
Bado.
I don't have that money.
Hatujafika hapo.
How much? What else do you have?
Yes.
They'll take you. You'll be shocked to know there's antibiotic that costs 100 bob.
Yeah.
And works as effectively as that one that costs 1,500.
Yes.
But they'll always start from the other one.
Of course, because it's more economically.
It's money.
Yeah.
Yeah, it's a business.
Yes.
Yeah, if you don't ask for options, I will assume you can afford it.
Yeah, that's so true.
Yeah.
Yeah, because I like kuna kadawa napendanga kanaitwa night nurse. Now night nurse is a variation of Flugon. Flugon is 150 for the same number of tablets or capsules. Night nurse is 1,000.
Yeah.
But in my head, night nurse works better.
No, it is in your pocket.
No, I promise you, it's in my head. Why I say it's in my head? Because even when I'm broke, nitatafuta pesa ya kununua night nurse na sitanunua Flugon.
Yes.
You see what I mean?
Yes.
Other medicines I'm okay with, but I don't know why it is.
It's just the night nurse.
Yeah. So with that particular, but it's the same with many people.
Yes.
You know, we have choices and we have wishes.
Yes.
What I wish for and what my choices are, and what am I willing to sacrifice for this?
Yes.
And a lot of people, by the point where they're ill, they're willing to sacrifice anything, to the point where they don't know how to ask for alternatives. I never even used to ask for alternatives until I came back to Kenya.
Yeah. Oh.
Yeah. Because in the UK, if they write you a prescription, it's one price.
Okay.
Prescription ni bei moja. So haijalishi kama ni Panadol ama ni kama ni antibiotics, ni bei moja. You see, if it's 500, it's 500 for all medicines.
Like a package.
Yes. So if you're written 2 prescriptions and prescription is £6, you pay £12. So I think they did that to discourage people from just gava subsidize
dawa.
So could discourage mtu aende kwa daktari, and because hata hiyo pia subsidized, your GP is subsidized. Yeah, well actually your GP is paid for by your taxes. So you never have to pay for your GP at the point of receiving care.
Yeah.
So if I make an appointment with my GP, it might take me longer to see my GP, but I never have to go out of pocket
to pay for it.
So it's paid for na taxes. Lakini na yeye akiniandikia, hata niandikie Panadol, £6. So as long as you're carrying a prescription to go to the pharmacy. So now people will go to the doctor and wataandikiwa. Na kama ni kitu unaweza get cheaper without a prescription, you get it without a prescription. If it's something that you can get over the counter. But we should also adopt the same. Because we have those choices, but we don't implement them because a lot of us haven't been really interacting with our care.
Yes.
Without people like you telling us that we have a choice. We don't really interact with, do I have a choice? Kama ni Panadol, kuna Panadol ya 50 bob, na kuna Panadol ya 10 bob. The main ingredient ni paracetamol.
Yes.
So Panadol ni paracetamol lakini kuna brand. Na paracetamol generic ni paracetamol. If it's 500 milligrams paracetamol, it's 500 milligrams paracetamol. In this one, it's the same drug.
It's the same, yeah.
But I'm buying it for more expensive because this one is branded and this one
is not. Yes.
Now there's nothing wrong with generic medication.
No. It works very well.
Exactly.
Yeah.
But when people hear that word generic, wanaona ni kama it's not as good. That's not true.
And what you need to know is, unfortunate as it is, on a given day, I'm sure you've seen it when you go to see your doctors here.
Yeah.
Part of the people seated are not patients; they are medical representatives, and they are selling medicine to doctors.
Yes, that's true.
And they are coercing them.
Yes.
Use our brand.
Yes.
So you will see the doctor will write for you a particular brand.
Yes.
But that's because there's a pharmacy that is coercing them, or
giving them
whatever bonus, whatever in
yes.
motivation, incentive, whatever you want to call it, for them to push that medication.
Yes.
So it is in my interest to write for you that.
Yes.
But when we are having this conversation and I'm able to ask, how much will that cost me? I can't afford it. The doctor will then step back and think, okay, either way, they still won't buy it. So let me write something else.
Yes.
Because I don't have the money.
Yes.
I will take your prescription and go away.
Yeah.
I will not buy it.
Yeah. Yeah.
So that's why that question, don't ever leave the office without asking.
Yes.
How much is all this?
Yes.
They should be able to know.
And if you do, then would it be possible at the point of, when I get to the pharmacy, is it generally acceptable practice to give my this is my prescription, but
cost it
exactly. Can you tell me what ranges of these drugs of the same potency? Because that's very important.
So yes, I know what you mean. So some pharmacies will do that.
Yes.
Some will tell you this is exactly what the doctor ordered.
So
we can't be able to give it to you.
Yes.
Go back to your doctor.
Akwandikie.
So
you have to really do this at the point of being of prescription.
Yes. So if you live there and you don't, there are some pharmacies that will, for example, if you go outside of the environment where the doctor was, they're likely to tell you, there's another option for this.
Yes.
But within that environment, trust me, they're all trying to sell the same thing. They'll be like, no.
Yes.
Hii ndio daktari amesema, hii ndio tunanini.
And sometimes you'll even find that a doctor will give you a prescription and tell you to go to that pharmacy.
Yes. Yes. And when you dig a little bit, you find there's some shares. People are,
yes, kuna kakitu. So yeah, I think this is actually I'm finding this and all our talks, all our charts, all our segments. I find them so informative and so useful because it makes me think about so far how have I interacted with my medical care, with my health.
And I keep asking every Monday in the group, the Patient's Voice Kenya, I try to ask, so, how are you interacting with your healthcare system now? Yes. Is it better?
Yes.
Do you go there feeling more empowered? Yes. Or is it the same?
Yes.
By default, or no, by design, it's not by default. Yes. It will be different because you now know something you didn't know about.
Exactly.
Yeah. And
you learned something.
Yes, you learned something. So the last question you should ask, well, it's not the last, second last.
Yes.
It's about getting a second opinion.
Yes.
This only applies if you see your general practitioner. Because you may go to see them and then they say, okay, it looks like you have something going on with your chest. We'll try to treat it. It's not working.
Yes.
Here's another round of medication. At that point, you can ask, can I get a second opinion?
Yes.
And by design, they're supposed to refer you.
Yes.
Yeah. But now the way things are, they may refer you, but they may refer you based on other things.
Yes.
So you should do your homework. Even when they refer you, do your homework. Yeah. You understand?
Yes.
Yeah. So the problem we have now in Kenya is most people don't go to general practitioners.
True.
We go straight to the specialist.
Yeah.
Straight. It's like, okay, I'm having these issues. Okay. Yeah. I need a gynecologist.
But where are the general practitioners?
Oh, they're there.
Again, I ask, but where are the general practitioners?
Well, you need to find us to show you where they are, but we have a lot of general practitioners who are listed.
Yes, but like, for example, I know that if I go the other side of town, and this is why sometimes when we talk here, like you say things, and I think, Nigeria Islands. Because I see it's
but
so weird.
The same way the person from Eastlands goes all the way to Ngong Road to see a specialist.
Yes.
In that office, that building where there's a specialist, there's a general practitioner.
But the thing is, again, this is why it's so important when we do these sessions, because number one, I'm learning a lot, and I'm otherwise very knowledgeable, very open-minded. Yani, I look for information everywhere, every day. You see, Sasa, where like in the system that I'm used to in the UK, we have a GP in every locality. Their offices are very well signposted. This is a GP, but also because they belong to the NHS, which is the National Health Service. Yes. So it's very clear. This is a GP. You can go register. Kama wewe ni raia. Okay, sasa mimi kutoka tu hapa Greenspan mpaka Caltex, we're in Donholm, for those who don't know. Yeah, that is a span of nearly 1.5 kilometers. Sindio?
Yeah.
Where are the GPs?
There's a GP office in Greenspan. Yeah. Okay. What the other people will tell you is, so there's all these satellite clinics.
Okay.
There's Meridian, there's AR around the corner, there's Aga Khan, Mata, name it, Avenue. All these satellite clinics have their GPs in there. But people have the perception of, if I go to a GP, they are going to refer me anyway. Why don't I refer myself?
They might not.
They might not.
Yeah, and in most cases they won't unless you need a specialist.
They will not.
Yeah.
But the problem is now we've tuned our minds to think only specialists can handle the issue. Now what that has led to is a lot of hopping from one specialist to the next because they're not finding what the issue is. This person, your first assessment when you're sick should be by a GP.
Yes, that's
so
true.
that they can assess the whole of
general,
you. Not when you go there and you think, nimekuwa nikiumwa na mgongo, so my problem is I need a neurologist.
Yes.
But you could be having other issues that are leading to that back
pain. It might be postural, which would be very easy to assess even by a therapist, not just a GP. You know what I mean?
Yes.
Yeah. It could be something to do with your job. You know, why would you go and see a neurologist when a GP can ask you 5 questions and tell you and assess you in 5 minutes and tell you this is probably work related, let us try ABC,
yes,
and then come back in a couple of months, and if that works, then you don't need to come back.
Yeah.
And you don't need the stress of seeing a neurologist who is a specialist, and you don't need, even more importantly, the expense, because with specialism comes additional expense, no?
Of course. It comes with of course. I'm a specialist.
Yeah.
I will charge you more.
Yeah, of course.
Yes.
Yeah.
And it doesn't matter that you see me and I don't sort out your problem.
You've paid my consultation
yes,
at the very least.
You will pay, move to the next specialist and the next and the next.
Yes.
Then before you know it,
your
Sharon, you have 5 doctors. Why do you need 5 doctors?
Ungeona GP,
yes.
I eliminate.
You have 5 doctors. Oh, I go to I don't know who for my hypertension. I go for I don't know who for my diabetes.
All this can be dealt with by the GP.
And then all these people have your file, and they don't know what else is going on in the other office.
Yeah.
Then there's no care coordination.
Yes.
And then you wonder why you're not getting well.
Yes.
Because the medication he's prescribing is fighting the medication that person is prescribing.
Yes.
And it's just crazy.
Yes.
So should you get a second opinion should be a question that is being answered by your GP.
Yes.
Yes, take home that. Take home that.
So, an average person like Naita Tieno, for example, one Sharon Onyango, who is generally well, but once in a while I feel like I need to see a doctor because I've had this cold for more than 2 weeks. I should go see a doctor. Would you recommend that such a person generally find a GP before they get ill and register with them so that when they're ill, they already have a file there? So that when they call to make that appointment, these people already know who they are?
Yes.
Is that how it works?
It's not how it works.
Yeah.
It's how it should work.
Yes.
And the importance of this is that, and even when further along you see your GP and they refer you, every time you go to your specialist and whoever, please bring back your information to the GP so that you have one person who coordinates all your care. And if you can't do that, we'll do it for you.
Yes.
The reason being, at the end of the day, you need a record that shows a clear picture of the whole of you.
Yes.
Not that doctor has this and that. So that every time you go to a new doctor, your GP can then share your file with your specialist. And it's a complete file.
Yes.
You understand?
So would you, from what I'm hearing, I think that it's wise for somebody to find a GP either in their local area or in an area where it's accessible to them.
Yes.
In case, number one, for minor ailments that they need to see a doctor for. And number two, and more importantly, for the coordination.
Care coordination.
Exactly. And if you cannot find a GP...
Yes, look for us. We will find one for you. And if you don't have time to go and collect your documents from doctor number 1 to doctor number whoever the number you saw, tell us. We'll collect it, all of it, and present it to your GP so that you have a very well-rounded history.
Yes.
So that at any given time, they can just use that file at your GP to be able to help you whenever you're visiting a new doctor. That will save you a lot in terms of diagnostics.
Yes.
If you don't take that from me, I'm not sure who else will tell it to you.
Yes.
Diagnostics go as far as where your history stops.
Yes.
So if your history is long enough and gives all the information, the doctor may not even need to prescribe any lab test or whatever for you.
Yes.
But if all you can say is nauma na mgongo and that's it, and then you don't say I have done an MRI before, I have done ABCD, I will prescribe every new thing because I'm not God. I can only use the information you give me to treat you.
That's so true. That is so true. So
care coordination. This question is very important. Don't ask your specialist about a second opinion. Ask your GP about your second opinion. Yes.
Nilienda to this doctor, they said this to me, according to my history, do you think I should go with
Yes.
their diagnosis?
Yes.
Or do you think that there's someone else who I can see who can give us a better, the possibility of a better outcome
Yes.
for my history?
Yes.
But this doctor, for example, when we were kids, we had GPs.
Yes, we did.
When we were kids, we all had family doctors.
Oh, yes.
And now,
I remember
don't even
mine.
hear people talking about their family doctors.
And if they do, it's a specialist of some sort. Yes.
Yes, that's true, because people now...
They say, my gynecologist.
Yes.
My, what other problem do we normally have?
Neurologist. Do you know what?
My neurologist. My this, my that.
It's so
all
weird
these people.
That as a therapist, not many of my clients, I used to hear people saying neurologists. Here in Kenya, it's almost everyone I treat who've had any type of back problem or who've had any type of even musculoskeletal problem that don't need seeing a neurologist.
Yes.
Have seen a neurologist.
Yes.
Yeah.
Because there's no system that stops us from choosing to go and see a neurologist. I go because I want to, because I feel like, because Sharon said that is a neurological problem, because it's a back issue. So I go to see the neurologist.
But my
and the
doctor
reason
hasn't
why,
prescribed it.
yes,
Yeah.
and that's the reason why I will see the neurologist. They'll do the best they can. I
Yes.
will not get well
Yes.
because that is not a neurological problem. Thank you. Yeah.
Let it sink.
Let it sink.
But I think from our chat today, I am seriously, personally, going to find myself a GP.
And we should have like find your GP
Yes.
campaign.
Yes. Find a GP.
Okay.
Yes?
Noted.
Yes. But find me a GP.
Yeah, I'll find you one. No, honestly, we all need to have a GP and
Yes.
have a file that
Yes.
can speak about Irene's medical history.
Yes.
You know?
Yeah.
You can have your own carry book, like
Yes,
the one
exactly.
I have that
Yes.
I sell to patients who are willing.
Yes.
But you need a medical person
Yes.
who has your file,
Yes.
so that they can be able to share it with whoever else you're going to go see. Because you never know when you will need that file.
That's true.
You never know when that doctor needs the whole profile about
Yes.
who you are as
That's
a
it.
patient.
Yeah.
And what the information you have is not enough.
Yeah.
And your GP, because they remain the same, you will continue to go and they'll continue to have
Add
your
it.
file.
Yeah.
Your specialist can only be your specialist until you get well.
Yeah.
Can we agree on that, first of all?
Yes.
Just because you went and saw whoever, Dr. B, they did a surgery, that is the end.
That's it.
Go back to your GP.
That's true.
Yes.
Wait, actually, after, and this is another thing, yeah? When I've had many surgeries, being a sports person, you look good, you feel good, but
Yes.
also you have injuries. So I've had both knees keyhole surgery. What happens is, after you leave the hospital, your specialist, Mr. So-and-so, will tell you, we are prescribing you 6 weeks of physio. After that, or even before that, after 2 weeks of out of surgery, go see your GP and then proceed to physio. Physio will then also send you back to your GP.
When
will
they're done.
release you back to your GP with your new notes, with your new bundle of notes, and send those notes to your GP. So yeah, it's so important to have that one surgery that has all your, documents.
Yes. That's your primary caregiver.
Yes.
Specialist is secondary caregiver.
Yes.
Always go back to your primary caregiver.
Yes.
They are the ones who are keeping your scores or your
Yes.
goal, whatever you want to call it.
Yes.
But if you don't have that, then you're treading on very dangerous grounds.
Oh wow.
Yeah.
Get a GP, guys.
Get a GP. Last question you should ask is, what questions haven't I asked that I should have asked? Because sometimes we ask all the questions and then the doctor is wondering, why didn't you ask me this? You asked me all these things, but you didn't ask me this.
Yeah.
But this one is just on a lighter note.
Yes.
When you're about to leave, you say, Doctor, is there anything else that you would want me to know?
Yes.
And they will tell it to you.
Yes.
And the question that you should keep asking if they say something you don't understand is, what do you mean by that?
Yes.
Always ask that part. Don't say,
clarification.
Sawa. No. What do you mean by that?
Yeah.
So that they can be able to tell you what they mean.
Yes.
So those are all the things you should ask as questions when you see your doctor. I know it was a lot. We'll probably... No, whenever you want to refer, you can go back to the video, write down a few questions, and then head on to your doctor.
Yes.
Number 2, remember we said it's ABC. It's as simple as ABC, how you're talking to your doctor. 1, A, you ask questions.
Yes.
B, you be prepared.
Yes.
Be prepared. And we've talked about it.
Yeah.
Your history.
Yes.
Your care coordination file.
Yes.
Research on your Google and just find out, what is everybody saying out there that you can go and ask the doctor.
Yes.
Be prepared. Don't get there and you don't have your questions that you're going to ask. When you get to the door, oh, by the way, daktari, kabla niende, there's this chest pain I've been having. They have finished to see you and even written everything. That is when you're remembering another symptom. Write down your symptoms. Track them.
Yes.
Write them down and say, I've been feeling a headache day 1, day 2. I've had a headache for 7 days. Headache for 1 day and headache for 7 days mean different things.
Yes.
Just so we are clear.
Yes.
It's not the same.
Yeah.
So that's why they ask, umekuwa na fever for how long?
Yes.
Umekuwa ukikohoa for how long?
Yes.
A cough for 1 week, a cough for 2 weeks, a cough for 4 weeks.
Very different.
Yes. So track your symptoms.
Yes.
Write them down. I've had a cough. It started on this day and it's continuing. So every day you cough, you write it.
Yes.
I've had a headache. So by the time you're going to see the doctor, you're very well prepared. You're saying, my symptoms are ABCD. I've had them for this long time. I've done my research. I've discovered ABCD. This is my file with all my documents. That's you being prepared. It makes the work of the doctor very easy.
Yes.
So that there's no nilisahau, actually nilikuwa niulize, plus your questions. Now you know the questions to ask. That's how you're prepared.
You heard it here first.
Yes, you heard it here first. And then the last thing is the C.
Yes.
Communicate your concerns and desires to the doctor.
Yes.
There's no doctor who is sitting with a gun who will shoot you if you tell them what your concern is.
Yes.
AKA cost.
Yes.
AKA my religious beliefs.
Yes.
My culture.
Yes.
Tell the doctor.
Yes.
Tell them, yes, I understand daktari, but where I come from, hatufanyangi hivyo. How else can we approach this thing?
Yes.
Instead of ukimaliza unasema, hey, daktari hataka kunisaidia.
Yeah.
Let me go find another doctor.
It's like patients who can't have blood transfusions.
Yes.
Now, in the past, it was mainly because of blood loss or the possibility of blood loss. They found a way years ago around it, which is they funnel the patient's own blood back into their system somehow and give them more fluids so that they're hakuna ile excessive loss. So they found a way around it. But that's because enough patients said that I would rather die than you giving me someone else's blood.
Yes.
Because it's against my religion. Because it's against my beliefs. So if that was made a possibility by enough people standing their ground, so we can also say, siwezi fanya hivyo kwa sababu I don't believe in it.
Yes.
So what are my alternatives?
Yeah,
is it death?
Do I have? Yeah.
And even if it's death, am I ready to die for this, my belief? And if I am, then doctor, don't let me die. No, it's true.
You sound like a movie.
I used to be an actress in school.
In our dreams. Oh my God, a doctor, don't let me die.
Doctor, don't let me die. Please tell me the alternatives.
Yes.
I have children, a husband, a business.
Oh my God. You're just funny. Yes, but literally, when you're choosing a doctor, let's go back to basics. When you're choosing a doctor, can it be a doctor that you can talk to freely? Don't go to a doctor you're afraid of. All these things cannot happen if you look at your doctor and you're thinking, oh my God, I can't be able to say anything.
Yes.
No. Choose a doctor that you can freely be able to engage with.
Yes.
And you have the right to choose a doctor.
Exactly.
And if you don't know how to get the choices, look for us.
Yes.
We are going to help you to choose.
Exactly.
We'll find for you doctors who suit your profile.
Yes.
And you have the right to interview them.
Yes.
And pick the one that works best
exactly.
for you. Okay?
You know, like one time, I say this openly because I would like more women to come out and speak loudly about it. I had very severe postnatal depression, and it led me to spiral out of control. And I went and saw a psychiatrist. Now, this psychiatrist, I went and saw him out of desperation. It was in Aga Khan or something like that, one of those big hospitals. Because I thought, I'm so desperate, I need the best, I need somebody now, I need to pay the most amount of money to get me the best care. At the time, I was in my early 30s, late 20s, and I wasn't as vocal, as empowered, and as even as articulate as I am now, and as confident. And as open. Anyway, I went and saw this guy. He was an older Indian man. Being an older Indian man, he had his own values, in his own value system. He was quite old, actually. And I'm not saying that all old people are judgmental or whatever. But number one, I found it very difficult to speak to him because he couldn't relate to me.
Yes.
Number two, he judged me openly.
Yes.
He literally openly told me, "You're a shit human being. Your poor husband.
Oh, no.
How do you expect him to cope with this?"
Yeah, that's...
You see what I mean? And this, I know this is an extreme example, but it happened to me, so it's happening to people out there.
It's not as extreme as you think.
Yeah.
Yes. It happens a lot.
Yeah.
Judgment.
Yes.
And the thing about judgment is it happens whether they speak it or just their body language. You'll just be able to tell this person is judging me.
Yes.
And, you know, at that moment, you completely... you zone off. And you don't do anything about it. But, so there's that part. What gets to me is, why do we continue to sit there?
Yes.
I know they're judging me.
Yes.
But I sit there and continue to engage with this person.
Yes.
Go away and come back another day. Receive the same judgment. Like I don't have a choice. That's the part that I don't get completely.
Yes.
Because we all have a choice.
Yeah.
You can be able to interview doctors until you find the one that your rapport clicks.
Yes.
That's the one you sit with, because that's the one who will help you to get your outcomes with the minimal fees applied.
Yes.
And, you know, you having a good experience with it. Yeah.
Yes. Let's also remember, and this we talked about in our very, very first discussion. Yeah. When you buy healthcare, and we are buying healthcare,
and it's expensive.
Exactly. When you buy healthcare, you should treat it the same way as you treat your rice, as you treat your ndengu, as you treat your omena. If I buy omena, and this omena is very bitter, kwa sababu kuna tu omena zingine jo ukikula, hey, ni kali.
I know.
You know, why would I go back to this the same mama samaki?
No way.
Yeah? And if it's somebody I didn't know, if it's somebody I knew, but it was just this particular batch, then it's fine.
I will let them know about it.
I tell them and say, "Anikinunua hiyo tena mimi sitarudi." You know. But when we consume healthcare, we consume it as if, as you say, we don't have a choice.
Yes.
But if we treated it the same way as we treated everything else that we buy, what we forget is this is our most precious thing that we have, life. And the choice of doctor could be the difference between you keeping it and losing it.
Agreed.
And the choices we make about maybe having a GP and having all your records under one roof could be the difference between you keeping it and losing it.
Yes. I'm laughing because I'm just thinking, someone said, I can't remember when I was having a call with someone shopping for insurance. And said, but the insurance already chooses for us. They give us a whole list. I said, no, that is why they give you the list.
Yes.
The list does not have one doctor. It has hundreds of them, so that you can choose there.
Yeah.
They don't choose for you. They tell you these are the people we pay.
Yes.
They don't say these are the people you should go and see.
Yes.
If that was the case, then they would give you one or two.
Yes, that's
They
true.
give you a whole list and say these are the people we pay.
Yes.
Please feel free.
Yes.
Pick anybody on
It's
this
on
list.
you. That is your
How
responsibility.
do you pick the person on that list? The same
Yes.
way you say nataka kwenda holiday Mombasa.
Yes.
Unatuma sijui nini huku Baobab, unatuma sijui wapi 5 hotels.
Yes.
Then you pick one.
Yes.
Why can't you do that for healthcare? Why can't you do that for doctors?
Yes.
Why? You're paying for it, whether
But
it's insurance
I
or
think in
not.
most cases, as you say, we don't know we can.
You have the right to choose.
Yes.
Not just the facility, the doctor.
Yes.
You have the right. Yes.
Now we know.
Okay.
You
My
know.
work is done here.
No, it's far from that. We want you every week because honestly, every week we learn something new.
Yeah.
Now we have questions and we know about GPs, and I hope more people out there listen to this and go and get themselves a GP.
Yes.
Because a GP is not just for you. If you have children, it's for those children. Because all your family records now
Will be
are under one roof.
Yes.
You know, if your child is
coordinate
ill,
your care.
you can go and say, can I have my child's file or a copy of my child's file?
Yes.
So that I can take it to the hospital where my child is.
And
so that
even if
can
they
have-
don't give it to you,
Yes.
tell them, I am going to see Dr. ABC.
Yes.
Send my file.
To them.
Yes. That.
Yes.
So that we can have some sanity around healthcare records
Yes.
in Kenya.
Yes.
There's no sanity in it.
No.
I go to Aga Khan, I have a file there. I go to Nairobi Hospital, I have a file.
there.
I go to
Yes.
me, Irene, I
Yes.
have 50 million files.
Yeah.
But there's no one person who has
has
all
all of
this
them.
information together. And then I'm hoping that one day when there's an emergency, God forbid,
Yeah.
that they will give me the right care. How?
How is it?
At least your primary doctor. Sinanga.
Sinanga.
Niko na secondary. Juu wote ni specialist.
Yes.
No. You need to have a primary doctor who is a general practitioner.
Yeah.
Who is your care coordinator. Sawa? Yeah.
And in terms of, I know we keep talking about costs. In terms of having a GP in Kenya, how cost, not in the long run saving me money, but in the now, do they also work with insurance companies?
Yes, they do.
So if I go to my insurance company and get insurance today, they'll give me a list of GPs that they work with.
Oh, all of them have. Yes, there's a
People
list.
just don't interact with the GPs.
No. They just don't. Or we just have come to that culture of it's more prestigious to say
My specialist,
my gynecologist,
my neurologist,
my all these things, my pediatrician,
Yes.
all these things.
Yeah, and most children never need to see a pediatrician as a what's it called, as a specialist,
And
unless
then
they have a problem.
Yes, and then people start complaining. Oh, every time I go, this pediatrician, they make me wait 5 hours. They are specialists.
Exactly.
Therefore, they see specialized cases, which are
Yes,
many,
yes.
because they are planned.
Yes.
They are put together.
Yes.
So you will sit there and be very nice.
Yes.
And when you present yourself, you say, mtoto wangu amekuwa kikohoa, they will write the same medication that your GP would have written.
Or
Save you
even
time.
that your pharmacy might have given you, a pharmacist, if it didn't need a prescription.
Yes.
You know?
So please take away the ABCs, ask questions, be prepared, communicate your concerns and desires. We've told you the questions you should ask. And we have said the to-do on your list this week is to identify your general practitioner around where you stay.
Yes.
And if you can't, look for us, Patient
Yes.
Support Services Africa. We will help you
Yes.
to start your file with your GP
Yes.
and collect whatever information in any hospital you've been
Yes.
to bring it back so that we have a file that completely speaks about your healthcare
Yes.
for you and your family.
Yes.
Yeah.
Thank you so much, everyone, for joining us, and thank you, Thank you, Irene Ogong'o. Mrs. Miss Marango.
Irene Ogong'o is just fine.
Thank you, Irene Ogong'o, and thank you everyone for joining us today. And don't forget to tune in again next week, Wednesday at 6 p.m. for even more insights on how to interact with our medical system.
Yeah.
Asanteni sana.
All right.
Have a good week.
Bye,
Thank
guys.
you. Bye.